cancer targets missed and pushed back by a year in a further blow to Sunak. We're going to read into this more from iNews, you guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is Reganelite here with an article from iNews with a headline that cancer targets missed and pushed back by a year in a further blow to Sunak. The PM pledged to improve performance against the 62-day standard wait for cancer treatment and to 70% by the end of this month, but this has now been pushed back until March 2025. Guys, while you're here, make sure you hit the like button and share this across social media so others are notified of this video. Once again, more targets have not been hit by the Prime Minister. In a man who says he's planning to clear the backlog when it comes to migrants, clear the backlog when it comes to the National Healthcare Service, and in a very serious battle against cancer, he has failed to hit the targets when it comes to cancer, which is an extremely difficult thing for people to go through. And if anybody's listening to this who has either suffered or has gone through cancer, my absolute heart goes out to you. And at a time when a certain royal family member is suffering from cancer as well, this will no doubt put things in an even darker spotlight for the Prime Minister as well. Anyone who is suffering of any sorts, not just cancer treatment, but in any sorts, needs as much care as they can possibly get. But it should not be a case that people should have to turn to privatisation in order to get that treatment. And unfortunately, we have a situation because our NHS is in such the crisis that it is, and there appears to be no solution right now when it comes to this current government and this political party running it. People will turn to the private sector when they have the money to be able to get the treatment that they need, because there's just not enough doctors, there's not enough nurses, there's not enough hospitals, there's not enough equipment, there's just not enough of anything in our healthcare service. And a lot of funding that is going into our healthcare service is going into the healthcare. Yeah, the record levels of funding that they always brag about and the investment they brag about, the government tells you, goes into the NHS. And guess what? Chunk of it goes out of the NHS, and guess where that chunk of that money goes? Oh no, it doesn't stay in the NHS. No, it actually goes into the private sector for healthcare. The private healthcare sector. Yeah, a good chunk of it. Yeah. So all that money that we pay in to like national insurance and other taxes and whatnot, we invest this. We put all this money into the NHS. A lot of that money does not stay in the NHS. It's so much less than it used to be. And they want to run it down, the Conservatives. They want to privatise completely our NHS. They want to privatise it completely, okay? Now, obviously, I have my criticisms of West Streeting. I have my criticisms of Labour because I think their plans to use the private sector to help clear the backlog worries me, and I really don't trust West Streeting with some of his wordings and things that he said about our NHS, so which makes me think that we're going to go even more down the privatisation route, which will probably mean takes us one step closer to the end of the NHS, which I don't like either. But I just don't know what the solution is right now. We are the NHS, the National Healthcare Service, is so entangled with private healthcare. It's almost impossible to untangle it right now. It really is. But specifically here on cancer treatment, just again, people who need that treatment aren't getting it. Desperately need this treatment. We're talking about life and death for some people. That's how big this is. So the government has missed its own cancer treatment targets in a further headache for Rishi Sunak and his flagship pledge to reduce the NHS waiting list. The latest figures from the NHS show that 92,000 patients have been waiting more than 65 weeks for treatment, while 10,000 cancer patients in January waited longer than 2 months to start treatment. The Prime Minister has promised to eliminate waits for more than 65 weeks for elective care this month, but this has now been pushed back to September. Kicking the can down the road is what he's doing, basically, guys. Mr. Sunak has also pledged to improve performance against the 62-day standard wait for cancer treatment to 70% by this month. Though an update from the NHS on Thursday showed that this has now been delayed by a whole year to March 2025. So this is him basically again kicking the can down the road. It means the government has now missed all its targets to slim down waiting lists, with particular concerns over those waiting for cancer treatment who have the biggest chance of survival the earlier their care begins. Almost all women with breast cancer survive their disease for 5 years or more if diagnosed at the earliest stage, according to cancer research. This falls to around 3 in 10 women when breast cancer is diagnosed and treated at its most advanced stage. Meanwhile, 9 in 10 people with bowel cancer survive the disease for 5 years or more if diagnosed at their early stage. This falls to 1 in 10 people when bowel cancer is diagnosed and treated at the most advanced stage. It comes as the latest figures showed the number of people on NHS waiting lists is now at 7.61 million, a slight fall in the previous month, but up from 7.19 million, where Sunak has outlined his pledge to reduce the backlog last year. In a further blow to Mr. Sunak and the 5 key pledges that he claimed the public should use to measure his premiership, including a promise to cut the NHS waiting list. Yeah, do you remember that? He made that pledge. The Prime Minister admitted last month that we have not made enough progress in his promise to cut healthcare waiting lists. So he's already failed on it. Asked during an interview with Piers Morgan Talk TV that if it meant he had failed to deliver his promise, Sunak replied, yes, we have. He's admitted. He actually admitted that he's failed on something. Oh my God. Ministers have repeatedly blamed strike action by the healthcare unions for stalling progress. Now, it has played a part in it, the strike action, but let's be absolutely clear about this, guys. They could have stopped those strikes at any time they want and get around the negotiation table to discuss pay and terms and conditions. They have chosen not to do that. Yeah, this is the government choosing not to have dealt with these strikes. They could deal with them and they choose not to. With Mr. Sunak insisting last month that industrial impact has had an impact on efforts to clear the backlog. In a statement announcing delays to healthcare targets on Thursday, the NHS Confederation said threats from further industrial action, including among general practitioners, long waiting lists and ongoing wider sector pressures, such as in social care, meant the coming 12 months would be another tough year for all local services. It called on the government to end the industrial dispute that continues to implement progress on waiting lists in order to give the NHS the best chance to recover. But will it recover, guys? Will it ever recover? At the moment, I can't see it. Junior doctors in England last week voted overwhelmingly to keep on striking until the middle of September in their long-running pay dispute, bringing a new wave of disruption to the NHS. Members of the British Medical Association, the BMA, voted to launch further strike action, in addition to 41 days of walkouts since last March, with 98% supporting further strikes and a turnout of 62%. West Street, in the Shadow Health Secretary, says Rishi Sunak has missed every single target, beating the NHS backlog with an extra 400,000 on the waiting list, and he became Prime Minister. Every minute matters when it comes to cancer, but Rishi Sunak has failed cancer patients who are left waiting dangerously long with terrible consequences. The chaos in the NHS will only continue if the Conservatives are given another 5 years in power. That is something me and West Street do agree with. It comes as a survey published on Wednesday showed that satisfaction with the NHS has fallen to a historic low, with only a quarter of the British public believing that the health service is working. The annual report by the King's Fund and Nuffield Trust think tanks found that the public confidence in the health service was just at 24%, its lowest level since polling began in 1983. People cite difficulties with seeing a GP as its biggest source of frustration, while half of those surveyed support raising taxes and spending more on the NHS, suggesting the state of the health service will be a priority for voters at the next general election. The eyes analysis of the NHS England figures show people are waiting more than a month to see their GP in some areas of the country. In a growing postcode lottery for primary care in the Midlands, where patients face the most delayed appointments at the start of the year, with more than 325,000 checkups were subject to a month-long wait. This is horrible. Really bad numbers, guys. Really, really bad numbers when you read in them. The state of how people feel about the National Healthcare Service. How difficult it is to see a GP now. Subjecting to month-long waits for something that could be a tiny little niggle, but could end up turning into something that could potentially be fatal. People are literally dying because of the state that the NHS has been left in at the hands of the 14 years of Conservative rule. And it really, really has been. What's happened to our NHS the last 14 years has primarily been at the forefront of by the Conservatives and their austerity and cuttingness they've done to it. It's only the last several years that satisfactory on the National Healthcare Service has really plummeted, and they are continuing to continue to allow it to plummet more and more and more with each passing day, guys. But what do you guys think? What do you make of the situation our National Healthcare Service is in? What do you make of the cancer targets being missed? Are you surprised that Rishi Sunak missed those targets, or are you not surprised at all? Let me know what you feel about all this and more in the comments section down below. If you found this video informative, please hit the like button, we greatly appreciate. Share this across social media so others are notified of this video, and subscribe because it really does help support the channel. And if you want to go one step further and financially support me and the work I do here, you can do so by becoming a YouTube member for as little as 99p, or join me on Rumble or Patreon for exclusive content there as well. Thanks so much for watching, guys, and I hope to catch you all very, very soon.